want to start with talking about process, and I'm going to be a little direct here. And I am extremely positive about these decisions we're making. I'm not ambivalent. I'm not unequivocal. These are the right things to do. They're the best things for the people that live here. But I want to start with process. Today there's a letter that you published in your newspaper in response to the editorial you wrote. In that letter, it referenced that Wellmont is great, Mountain States has ruined Wellmont. Okay, that's unfortunate. Okay, the lead director of Ballad Health is a former Wellmont board member who lives in Bristol. The chair of the committee that recommended these decisions lives in Kingsport and was on the Wellmont board. 75% of our board does not live in Johnson City. 4 of them live in Kingsport. 3 live in Johnson City. 1 lives here. 1 lives in Virginia. 1 lives in Greenville. So things are being said that are literally not supported by the facts. In the last week, I've watched Lisa and Eric get beaten up pretty good at some of these public meetings where people are standing up and saying things like people are going to die, babies are going to die, and they're repeating information that doesn't have any facts or data to support what they're saying. I'm going to read you a message that our folks received yesterday. You sorry C-word. Dropping Tier 1 emergency services to Bristol and other areas. Only in it for the effing money. Hope you and your families all suffer life-threatening trauma and die before you can reach adequate care. Happy holidays. So I am going to be fairly direct about this because I think a lot of bad information, there's an old saying that a lie gets halfway around the world before the truth gets its shoes on. I want to talk about the process.
Okay.
We knew that the trauma decision was going to be controversial. But we've been transparent about this from the day we proposed merging with Wellmont. Remember, Wellmont was looking for a strategic partner for reasons that were all appropriate. They decided that this merger was the right thing to do. And in that consideration, when we talked about it publicly, trauma was one of the biggest things we pointed to that was an opportunity to improve outcomes and realign our resources to put those resources where people will benefit. So we had 19 public hearings. The state approved the consolidation of trauma based on their own assessment of what the needs are. Even after the decision that's been made is implemented, this region will still have 25% of all of the state's trauma centers, with less than 14% of the population. But all 3, if you look at the major trauma between Holston Valley and JCMC, last year, Holston Valley had 150 major trauma cases. JCMC had 230. To be verified by the American College of Surgeons, which is the highest standard for verification, for quality, you have to have at least 250 to 300 cases. Neither hospital on its own could even be verified based on the highest quality standards. You can't even get past the first threshold. So taking the highest severity trauma and consolidating it in one hospital where you have the most consistent specialty coverage, where you have higher volume, that's the right thing to do. That's what I would want for me or my family, and I would want it for anybody else who suffers from a major trauma. That doesn't mean that Holston Valley and Bristol aren't as good at managing trauma. Today, and I think Greg would verify this, if cases are dropped off at Bristol, they will, if it's a major case that they can't handle at Bristol, they will stabilize it and they will transfer it. And that's what we heard from the orthopedic surgeon who said, we get some of those transfers from Bristol because they don't have all the breadth of all the subspecialties all the time in-house. It's a level 2 center. So so the idea of regionalization of trauma is not unusual. If you look at Memphis, there's one trauma center in Memphis. And there's a pediatric trauma center. There's one in there's one level 1 trauma center in Nashville that goes all the way up into Kentucky and all the way south of the Tennessee border in Alabama. I mean, if you look at the way the resources are being allocated here, it's not appropriate. I mean, if you've got Memphis, you've got Nashville, you've got Chattanooga. Chattanooga is part of both the Mississippi and the Georgia trauma system. There's nothing between Chattanooga and Atlanta. Here we have 2 level 1 centers and a level 2, almost 100% overlapping. So now here's the challenge that creates. When you do that, you basically have to replicate 3 times all of those specialists.